Hello and welcome to the E2i Intervention Exposure Tool for Trauma-Informed Care Focus Area Sites training. I would like to state that this is a re-recording of the webinar that was originally offered to sites on September 7th, 2018. There was some issue with the audio originally, so this re-recording will offer all of the same content provided at that live webinar so that it is clear for all sites who need to use this recording as a reference. I'd like to go over the training outline. We will first briefly review the enrollment tool, and then the main focus of this training is on the intervention exposure tool. We'll do an overview of that tool, and then I'll present information on the specific versions of the intervention exposure tool for the CPT intervention, TIA change intervention, and the seeking safety intervention. Towards the end of this training, we will also go through some examples of tool usage. The Evaluation Center team consists of our Principal Investigator Janet Myers and our Project Coordinator Beth Bordeaux. Beth will be a good resource for everyone if there's questions for the Evaluation Center. We also have Qualitative Evaluator Kim Kester and our Quantitative Evaluator Starlee Shade. I am Mary Guzet. I'm the Data Analyst for the Evaluation Center. All of the sites in the E2i initiative have site liaisons. For the trauma-informed care sites, Carol Dawson Rose is the TIA change and seeking safety site liaison, and Janet Myers is the CPT intervention site liaison. If you have any questions related to the evaluation, please feel free to reach out to us. We're here to provide technical assistance needs for data collection and all other evaluation related questions. I will likely be providing you information on data collection or any questions you have. And then for other issues, we will be likely triaging them to your designated site liaison. But if there is something else that you have a question about that someone else in our team can answer, we will certainly make sure that they're in touch with you. So please email us with any questions you have at E2i Evaluation Center at ucsf.edu. So now we'd like to begin the review of the data collection tools. The first is the participant enrollment tool. The participant enrollment tool will be collected and filled whenever a participant enrolls in the E2i intervention, and frontline staff will be filling this tool. At this time, frontline staff will also be assigning the person a participant ID for E2i. And all of the frontline staff who will be enrolling participants will be given a list of participant IDs by their data manager. Your data manager can provide you more information on this. Each site is going to be using their own participant IDs. Once the enrollment tool has been completed, it will be given to the data manager. All sites are going to use a paper version of the enrollment tool, and the data manager will be submitting them electronically to the E2i data portal. The data manager will submit them as soon as possible once they're completed and collected. Now I'd like to walk through the intervention enrollment tool elements. The first is organization, so you'll enter your organization here. Then the second item is where you enter the participant ID. And then you'll also provide the date of enrollment into the E2i intervention. You'll also provide the date that the person started services at your organization. In some cases, the date of enrollment into the intervention and the date that the person starts services at the organization may be the same. But there may be cases where the client has actually been receiving other services at your organization for a longer time period, and so we'd like to know when those services started. We're also collecting demographic variables on the enrollment tool. So this will include year of birth, that's just a 4-digit year. We'll ask sex at birth, current gender, Hispanic, Latino ethnicity, and race. Race is a check all that apply variable, so you can select as many of these options as needed as is needed for that participant. I would like to mention that all of the response options for these demographic variables are HRSA standard response options. We have to be able to compare the HRSA the data that we are collecting for the E2i intervention to the rest of the HRSA data, and that's why these response options were collected. So now we'll move on to the intervention exposure tool. The intervention exposure tool is going to be collected by frontline staff and it's going to be filled contemporaneously with patient-client contact. So anytime frontline staff has contact with a client for intervention activities, you want to fill this form at the time of that contact or immediately afterwards. We are also asking that each service provider conducting E2i intervention activities on a given day to fill a separate tool, so long as those activities are separately done. So for example, if on the first day that a client comes into contact with the intervention, a lay staff person conducts the screening activities for the intervention with the client, then after the screening activities are done, perhaps that lay staff person hands the client off to a clinician. The clinician then conducts a counseling session with that client as part of intervention activities. So in this case, on day one, the lay staff person conducted the screening activities and the clinician conducted the counseling activities. In this case, the lay staff person will need to fill one intervention exposure tool, and the clinician will need to fill another intervention exposure tool. This will allow us to understand the interactions that the client is having with the staff members as discrete activities. So in this case, you'll actually end up with 2 intervention exposure forms for that encounter date for a client. Another example would be on day 2, so the second time that a client comes into contact with the intervention. That client works with a lay staff person and the lay staff person does an assessment with the client and then also conducts case management activities with the client. In this case, the lay staff person is conducting 2 different activities with the client, but because both of those activities were conducted with the lay staff person, we only need 1 form filled. So just to summarize, each service provider conducting intervention activities on a given day will fill a separate tool for the activities that they conducted with the client. The intervention exposure tool data will be submitted to the E2i data portal in one of 2 ways. Either the frontline staff will either use a web-based data collection tool to submit information directly to the E2i data portal, or sites may choose to have their frontline staff only use paper, in which case, if that only paper is used, then once those tools are completed, they will be given to the data manager, and the data manager will submit them to the E2i data portal. So your data manager and your site leadership will provide more information to you on where and how to submit completed tools and which method you'll be using. It will be up to the sites whether they decide to use web-based data collection for the intervention exposure tool or paper-based collection, because it depends a lot on the resources that the site has available. And at the Evaluation Center, we will be discussing with your data manager and your site leadership if they have questions about which method might be best for your site. But more information will come from your site leadership and your data manager once those decisions are made. If the frontline staff are using a web-based data entry tool for the intervention exposure, the E2i Evaluation Center will be providing your data manager with a unique link for your site once your data collection is ready to begin. Data managers will also provide training to frontline staff on how to use the tool and access to the link. And I will say that next week, for sites who are going to be using web-based data entry, we will be providing a practice link, a unique link for your site for practice purposes, so that sites are able to start getting familiar with these web-based tools before actual data entry begins. The purpose of the intervention exposure tool is really for the Evaluation Center to collect all of the information we need to perform the multi-site evaluation for each of the interventions and for the E2i initiative overall. And generally what this form will be collecting is the when, who, how, what happened, and for how long. We're not collecting a lot of detailed information on the participants themselves. It's really more about the intervention activities that occurred because that's what's of interest for the multi-site evaluation. So when is the date of the encounter? Who is the service provider who's providing the activities? How is modality? What happened is the activity and then the outcome of that encounter. And then for how long did that encounter occur? And so we'll go over each of the elements in the tool in more detail in a moment. So each intervention will have a customized intervention exposure tool. Some elements on the tool will be the same for all interventions, and that will include the participant information that we collect, the date of encounter, and the service provider. There will be other elements on the form that are similar to one another, but each of the interventions will have their own unique set of response options depending on what is needed for your intervention. So I'd like to go over the common elements here first. So at the top of every tool, there's participant information collected. So again, the organization, the participant ID, the year of birth, the sex at birth, and the current gender. And the reason why we're collecting some of these same variables that we collected in enrollment is because we want to be able to perform some cross-checks on the participant information across all of the different tools that we're collecting for this initiative. So for example, if for whatever reason a participant ID had a typo in it, we would be able to use some of these extra elements, year of birth, sex at birth, and current gender, to help do some cross-checks to identify which participant this tool might belong to if the ID somehow had a typo in it. There are other data quality checks that we can do using these variables, but that's why we're collecting them at the top of every one of these tools. The intervention encounter details are next. We have the date of encounter. The date of encounter will always be entered as a 2-digit month, a 2-digit day, and a 4-digit year. And then you'll enter the service provider that was conducting the activities with the client. The service provider question is a check all that apply. So if the provider who is working with the client fills multiple of these roles, they can check as many of them as they need. So for example, if a peer staff is also a lay staff or a non-clinical person at your site, you can tick both lay staff and peer staff. Or for example, if peer staff is also a mental and behavioral health staff, you can tick both of those. We do really want to know if peer staff are being involved in providing the intervention, so that is why we've included it there. But again, you can check as many of these boxes as make sense for the role that the person fills at your site. Each of these options under service provider also have some examples of each type. I will say that these examples are not comprehensive. It is possible that there are some other roles that might fit under these. We're only providing these to you to give you a sense of what we mean for each of them. It's also possible that maybe you use slightly different job titles at your site. So prescribing providers would be medical doctors, physician's assistants, or nurse practitioners. Non-prescribing providers include RNs, LVNs, and LPNs, and medical assistants. Mental and behavioral health staff include social workers, therapists, substance abuse counselors, and there may be others at your site as well. Lay staff is anyone who is non-clinical, and this might include care coordinators or managers, services specialists, health educators, or outreach workers. And then finally, peer staff is any member of your target community for your intervention. So now I would like to go over the intervention-specific tool for CPT interventions. On CPT, the modality of activity may include individual, group interaction, phone, text message, or online. Online might be something like email, or if you're using social media in order to contact clients. If you select the individual option, we want you to select which type of individual session it is. So in CPT, there are a set of predefined sessions. So is this individual session part of that core protocol or a predefined session? Or is it a crisis session? CPT does build in a crisis session for clients who may need it at some point during the course of the intervention. And so we want you to indicate if it's a crisis session. If you select that the session is part of the core protocol, we would like you to use question 8A, which is the next question on your tool, to let us know which intervention phase that individual interaction is part of. So in CPT, you have focusing on trauma sessions and you have facing forward sessions. So just let us know which type of session that individual interaction is, if it's a predefined session. just jump back here. If you have a group interaction happening in your intervention, each participant in that group session needs to have their own tool filled. So the next item for CPT is activities. So for activities, you have your screening and assessment activities, counseling, and then other. We've included other here because we do understand that CPT may include some other services or activities for the client. And so if there are any activities you're conducting with the client that are not encompassed by the screening and assessment option or the counseling option, you can use other. And if you use other, we ask that you include a short text statement to explain what that activity was. And you are able to check all of the options here that apply for that particular session. So if an screening and assessment or counseling occurred at the same session, you can tick both of those boxes if needed. Next is the outputs and outcomes from the interaction with the client. So we want to know what the participant's status is in the intervention at the end of the encounter. And this might include intervention phase completed. This would be used if, for example, the person was working through the focusing on trauma sessions in CPT. If they finish all of their focusing on trauma sessions, so it's their last focusing on trauma session, you would want to indicate that the intervention phase was completed. Same can be said for the facing forward. If they complete all of their facing forward sessions, you'll want to tick the intervention phase completed there as well. We also want to know if the client will be continuing the intervention. So if you're planning on having the client come back for additional sessions, you'll want to use that continue intervention option. And then if the client is done with the intervention or for some reason will be leaving the intervention, they've completed or they've discontinued, we want you to tick that box. Then we want to know the reason that the person is completing or discontinuing the intervention. So you'll want to select one of these options. Have they completed all of the sessions according to the protocol? Perhaps the patient has achieved remission or they no longer need the intervention. The provider might discontinue the intervention for the client, or the patient themselves might decide to discontinue. So we want to know the reason why they've stopped the intervention. And again, for this outputs and outcomes, you can tick multiple boxes here if needed. Of course, in a way that makes sense. If someone's continuing an intervention, they won't also be completing it. But perhaps an intervention phase has been completed and they're also going to be continuing. You can use both of those boxes. And then the last item on the form is the duration in minutes of that exposure with the client. So we definitely want you to use minutes here. So for example, if the session was 1 hour and 5 minutes long, we would like you to enter 65 minutes. So that is the CPT tool, and we'll now move on to the TIA change tool. So for TIA change, there's also a modality of activity question. Here the only options are individual, group interaction, phone, text message, or online. The definitions of these are the same as the ones I stated previously. Again, online is anything like email or using social media of some kind to contact the client. And again, if you're going to be doing a group session within this intervention, each participant who is involved in the group session will need their own tool filled. The activities conducted for TIA change include screening, assessment, counseling, or case management. So you can select any or all of these items depending on what occurred at that encounter with the client. For outputs and outcomes, the options are referred for additional services, care and treatment plan developed, continue intervention, and intervention completed, discontinued. So in some cases with TIA change, clients might be referred for additional services during the course of your work with them. And so you'll want to indicate that if you have given them a referral. And then there's also a point in the intervention where you're going to be creating a care and treatment plan. So you'll want to indicate at what sessions that was done for a client. So really, again, the main point of this outputs and outcomes section is really to let us know what the participant's status is at the end of the encounter. And then finally, we have the duration in minutes for this tool. So how long did the session take? Moving on to seeking safety. In the seeking safety tool, we have the modality of activity. These items are all the same as what you've seen before in this presentation. The activities for seeking safety include the screening and assessment and the intervention session. So when you're using this tool for seeking safety, only clients who screen into the intervention will have this tool filled. So you'll still be conducting the screening and assessment with them, and then once they've screened in, you'll be able to use this tool to indicate that that occurred. And of course, you can select both of these options if needed, if both occurred during the session. For outputs and outcomes, similar to the other versions we've seen, we want to know the participant status and the intervention at the end of the encounter. For a screening encounter, this form will always have appropriate for intervention indicated because, as I mentioned in the last slide, only people who screen into the intervention will have this tool filled. If the person's going to be coming back for additional sessions, you want to use continue intervention. And that's the case for any encounter that the person has in seeking safety. If they're planning to come back again, you want to use continue intervention. And then if they are done with the intervention, you'll want to indicate intervention completed or discontinued, and then let us know why they completed or discontinued. And then finally, again, we have duration in minutes. And so again, minutes, everything will be done in minutes. If the session is an hour and 15 minutes long, you'll want to enter 75 minutes into this space. So if there are any questions about this tool while you're viewing this webinar, please feel free to reach out to others at your site who attended the webinar who have viewed as well. They may be able to answer some of those questions for you. Additionally, the E2i Evaluation Center is here for any data collection questions that you have. We're more than happy to discuss them with you to make sure that everything is clear about the different tools that we've talked about so far today. If you have any concerns about the tool, please let us know about that as well. And you can use E2i Evaluation Center at ucsf.edu to contact us. So now I'd like to go through a couple of examples of the tool usage. And I will say before I get started on this section that the examples we're going to provide here are intended to be more general examples to give you a sense of how the tools should be used based on a lot of the things we've talked about already today. So some of the workflows that we'll show you, they might not necessarily apply directly to your site, but they should hopefully give you a sense of how these tools should be used. So the frontline staff who are going to use paper tools only. This example applies to frontline staff only using paper tools at their site. So here's the example. The client is identified as eligible for the intervention. And so an E2i peer staff person enrolls the client into the intervention. Then the person also conducts the first intervention screening activity with the client. And then when the client completes that screening activity, the lay staff person introduces the client to a case manager to conduct the next intervention activity for the day. So then the case manager conducts a session with the client. And then at the end of that session, the client's referred to additional services, a care plan is developed, and a next intervention appointment is scheduled. So what are the next steps here? Which forms are filled during the client's first encounter with the intervention? So if you recall, the client was enrolled and then they initiated intervention activities. So in this case, an enrollment tool is going to be filled and an intervention exposure tool is going to be filled. So the next question is, how many intervention exposure tools are filled and by whom? If you recall, the person encountered a peer staff member and they enrolled. They worked with a lay staff person or a peer lay staff person in order to do a screening assessment. And then they were introduced to an E2i case manager in order to do case management activities for the intervention. So in this case, because that lay staff person, peer staff person conducted that first screening activity with the client, we want to have a form from that person to indicate the screening assessment was done. And then, in this case, I stated it was a clinician, but in this case, we have the case manager, who's perhaps a clinician, who helped the client with case management activities. So we need a tool from both of these people. So now I'll walk through the filling of these forms for this particular example. So the first form that is filled is the enrollment tool. So the E2i site is indicated. A participant ID is assigned. The date of enrollment is September 5th, 2018. And this client happened to have started services with the organization a couple months before. So we've indicated that date of start of services at the organization as well. The demographics, we enter the year of birth, and then we enter the demographic variables here. And again, as a reminder, for race, you can check as many as needed. So now that peer staff person who had the first intervention activity with the client, they're going to fill the first intervention exposure tool on this day. So again, the organization is entered, the participant ID, the year of birth, the sex of birth, and the current gender for all of the participant information. And then for the intervention encounter details, we enter the date of the encounter, the service provider, the modality of the activity. In this case, it was individual, and it was a screening and assessment. The peer staff person that held this tool, the only outcome that we have here for them is that they're continuing intervention. And then that activity took 15 minutes. So now, as we said, that the client on this same day had an interaction with the case manager. So in this case, the case manager fills their own tool as well. So the University of California, San Francisco, for this example, is the organization. We have the participant ID entered. Notice that it is, of course, the same participant ID that we've been using throughout this example, because we want to make sure that that ID is consistently used for the participant throughout the initiative. We have the year of birth, the sex at birth, and the current gender. Also fill the date of encounter, and then the person's role at the clinic or the organization. Then the case manager then indicates their modality of activity, the activities they conducted with the client, and then those outcomes. So in this case, the case manager provided some referrals to the client. They also did a care and treatment plan, and the client will be continuing the intervention and will be coming back for another session. And this whole interaction took 45 minutes. So remember, we're at a paper-based site for this example. So who is the enrollment form given to? The enrollment form is submitted to the data manager so that they can do electronic entry of that tool. Remember, for all of the sites, regardless of whether you're going to enter the intervention exposure tool web-based or on paper, all enrollment forms are filled on paper and submitted to the data manager. The intervention exposure tools, once they're completed, because this is a paper-based site, they go to the data manager as well for electronic entry. So now I'll be giving an example of how things might look at a web-based data entry tool site. So in this case, a client is identified as eligible for the intervention. So on September 1st, an E2i staff person enrolls the client into the intervention. After enrolling, the staff person conducts an intervention assessment with the client. They inform the client that the next group session will be held on September 5th, 2018. Okay, so in this case, the enrollment tool is filled. And what do you do with the enrollment tool after it's complete? As I mentioned previously, all enrollment tools are filled on paper and they're given to the data manager for electronic entry. Okay, so in this case, at that first encounter with the client, do we need an intervention exposure tool for the intervention assessment? And the answer is yes, because if the assessment is part of intervention activities, an intervention exposure tool is needed. So now we're going to skip ahead. So the client was told that the next group session was on September 5th, 2018. And so that client came to the group session. And this session was led by an E2i therapist, and there are a total of 4 clients in the group session. So the question is, who enters the data into the web-based tools? In this case, because it's a web-based data entry site, the E2i therapist, who's the frontline staff member who's providing the intervention activities, is going to be the one that enters the web-based data tools. And that's because at these web-based data entry sites, they're not going to have paper forms for the frontline staff to use. All of the information goes directly into the web-based tools for the data portal. When do the forms get entered? The forms are entered as soon as possible after the session is complete. As I mentioned earlier, the E2i intervention exposure tools, we want to have them collected contemporaneously or in as real time as possible for the interaction with the client. So in most cases, this will mean that the tools are filled immediately after a session or an encounter with a client. And in this case, because it's a group session, how many intervention exposure tools get entered? There will be 4 entered, 1 for each client who attended the session. So the web-based intervention exposure tool entry will be done using a link that is provided by your data manager. This link will be used to directly access the form. So as soon as you click on the link, you'll be taken immediately to the form. The form is going to be specific to your site. And we have spoken with your data managers about this in a prior training, and we've recommended that a shortcut or a bookmark of some kind be set up on frontline staff computers or tablets so you can easily access this web-based data entry tool. And that's because we know that this link, because of the coding that we had to use to make it unique to your site, is quite long, and we want to make sure that you can easily access the tools without having to do a lot of copy pasting or typing in and perhaps having some typo issues. So again, we're hope you'll be able to have a shortcut or some kind of bookmark for easy access. So once you access these tools, you'll be given some instructions at the top of the tool. And the really important thing to remember here is that when you're using these web entry tools, you should not close the form or tab or browser window that you're using to enter the form until you receive a confirmation message that your data has been successfully submitted. If you close the form or the browser window before you see this confirmation message, we cannot be sure that your data was saved. This is an example of the tool. So because the link is going to be unique to your site, the organization will already be filled for you. So then you'll move on and enter the participant ID, the participant's year of birth, the sex at birth, and the current gender. And then you click submit to move on to the next section of the tool. This is now the intervention exposure details section. You'll enter the date of the encounter. And on these tools, there is a today button. That today button, you can click it and it will automatically fill today's date. In most cases, that today button is going to be what you use because you'll be entering these tools the same day that the encounter occurs. If for whatever reason you have to do some back data entry, you can use the calendar picture there. That's a widget. If you click on it, a little calendar will pop up and you can select the date from there. You also can just type the date in using the 2-digit month, -2-digit day, -4-digit year. You'll also then select the service provider who is providing the activity. In this case, because it was the E2i therapist conducting the group session, they've selected mental and behavioral health staff. Then they'll select the modality of the activity. In this case, it was a group interaction. And then for the activities conducted, it'll be an intervention session. The outputs and outcomes, the client is going to be continuing the intervention because they're going to be coming back for additional sessions. The session was 45 minutes. And then at the end of the tool, you'll always be re-entering the participant ID. And we do this as a data quality measure to make sure that we don't have any tools that are accidentally entered for more than one person, and that all of the data, each tool is only used for one client. Once you've filled all this information, you hit the submit button. And then you're provided with that confirmation message that the form has successfully been submitted to the E2i data portal. Once you see this screen, you can close your browser window. And then if you need to enter more tools, so in this case, 3 more intervention exposure tools will need to be entered for those who attended the group session. You'll be able to reopen the link and you'll have a blank tool that you can use to enter the additional information. So that concludes the review of the intervention exposure tool for the trauma-informed care sites. If you have any questions, please feel free to contact us at the E2i Evaluation Center at ucsf.edu, and we are happy to work with you and discuss any questions or concerns that you may have. Thank you for your time.